Hey everyone, it's Rashni and I'm back with another video in my Spina Bifida Awareness Month series. Before I start, Flickerbug is right there on the floor, so if you hear anything, if you have not seen part 1 of this video where I go into what exactly is Spina Bifida, the different levels, and which level my son has, then go ahead and check it out right here first, and then come back to this video because I'm just going to pick up from there with part 2. So in this video, we're going to talk mostly about developmental questions that you guys gave me. The majority of my son's deficiencies are physical and not intellectual. Thank you, Jesus. Now, I will talk about the intellectual stuff first. He does also have what is called a CHIARI 2 malformation. I won't go into it in depth here, but I will look up some information and put it in the information box below so you can read up on it if you're that curious. When we were in the hospital, we were given a pretty confusing diagnosis, and they pretty much told us on one hand it could be the end of the world, and on the other hand it could be absolutely nothing. So far, thank God, he has had really great doctor's appointments with neurology, and he's hitting all his milestones. And with respect to physical deficiencies, he has lower nerve innervation from the torso down. Did you just toss your... One second. I'm just going to show you guys the man of the hour. Say what's up, YouTube? Say what's up, YouTube? All right, he wants to go. Right now, we are seeing it affect his ability to crawl and sit up and walk. The reason that it's affecting his ability to sit up, which is very unexpected for me, but I've kind of gotten used to it, is because his nerve innervation is uneven in his torso. So even though he's doing a whole lot better at this point, it's still not what it should be. And then with respect to his legs, one moves more than the other, and then it's kind of like lower, imagine like lower powered movement. It doesn't affect his ability to grow. However, we do have to use some assistive devices to put him in positions like standing so that his growth plates and his body can have weight bearing, and we do a lot of physical therapy that assists with his growth. By default, my son will get a wheelchair whether he can walk or not, because that is the level at which his spina bifida is presenting itself. We will, however, do therapies and things toward hopefully having him walk, but he will have a wheelchair by default. He just doesn't have one right now because I'm the wheelchair. Just carry him around. People living with spina bifida can also deal with diminished bowel and bladder function because obviously it is nerves below the waist. Now, because he's a baby, that isn't really a huge problem. However, as he gets older, he's throwing the remote control. As he gets older, we will have to see how that manifests itself for him. I don't really know the answer to this one, but I'm going to guess that he will have to visit the doctor for the rest of his life. Really? I have to guess that he will have to visit the doctor. You know what you're doing. You know what you're doing. I don't really know the answer to this one, but I'm going to guess that he will have to visit the doctor for the rest of his life. Now, the first year with spina bifida was a doozy. We were always at the hospital. It was overwhelming and it was a lot. It has slowed down significantly, and now it's more like annual, biannual checkups and you know, as needed if he has a specific thing that needs to be done. Yes, my son has physical therapy, he has occupational therapy, and they can have speech therapy, but my son has not had speech therapy at this point. I don't really know the answer to this one entirely either. To my understanding, there aren't any improvements that can happen over time. However, as the person gets older, you can kind of notice that they have the ability to move things. So that could be considered an improvement. You know, like for example, my son may not be moving something, but we don't know if he can feel it until he tells us that he can feel it. And then you can also work on muscles. It's the same way how you and I can work out our muscles and build our muscles. The muscle might be super weak, and you might be able to work it to the point where it seems like it's an improvement. So that's kind of my thoughts on that. Now, with respect to regression, I know that there can be regression specifically with a condition called tethered cord, where the lesion was closed on the person's back. The spinal cord somehow got caught in the scar tissue, and as they grow, it pulls. And if it's pulling, then it may diminish their nerve function, because obviously your nerves are not designed to be yanked on. So I know sometimes people will have to have further surgery for tethered cord, and it does present itself in a regression of your abilities. The majority of people living with spina bifida also have hydrocephalus. Hydrocephalus is what old people used to call water on the brain, and basically it means that your cerebral fluid is overproducing and it has no place to go. You're making too much, and so it kind of pools in your brain. Now, it's a chronic condition, so it's not going, that pressure isn't going to cause damage at one point, but if you have pressure in your brain from too much cerebral fluid over time, it can cause brain damage. My son does have hydrocephalus. It was horrible when we found out. Thanks be to God, a simple procedure called a ventricular shunt can help with it. Now, my son did have a shunt placement done about 4 days after he was born. Truth be told, over the long term, these past few months, 16 months of his life, it's been the least of our concerns. But however, when it did happen, we had the shunt, and then the shunt failed, which can happen, and then we had to have the shunt revised. And we did have a shunt failure scare at the end of last year again. However, that turned out to be a false alarm, and he still has the second shunt that he got when he was in the NICU. This is such an incredible question, and I do not know the answer, so I had to look it up. My first guess would have been to say no, it's not painful because it's decreased nerve connection or innervation in your body. So I would think that they would not be able to feel things and feel less pain, I guess is what I'm trying to say. However, I looked up something online, and it had was talking about neuropathic pain in adults with spina bifida, and so I'm assuming that there's obviously something called neuropathic pain, and I don't know what that is. And since my son is only 16 months old, he can't tell me whether he's in pain or not. So I don't know the answer to that. However, I will put the link to what I did find down in the description box below. All right, you guys, that's all I have for this video. Stay tuned. I have probably about 4 or 5 more videos coming up in this series. I'm sorry that they took so long. It's just been a crazy month, and I didn't like what I taped before, so I'm retaping it so I can get it out better. Until then, I hope that this is educating you guys. I'm reading your comments, and I'm glad that I'm helping you guys understand something that has come very close to home for me that I would have never expected to have had to deal with. And so I hope this helps someone. See you guys next time. Bye, y'all.